Hi, I'm Bandovic, and I'm Carmichael, and we're really excited to show you guys Nephro360.
Nephro360 is built using Unity, a gaming engine, and Oculus Rift, a virtual reality platform, which allows students to interact with educational models.
Students are also able to test their knowledge using interactive question banks and integrate their knowledge of gross and microscopic anatomy.
Students can interact with any segment of the nephron, including the glomerulus, where they can change physiologic parameters affecting glomerular function.
Students can better understand the renal filtration apparatus by appreciating its microanatomy.
They will then continue to be tested on their knowledge with interactive questions and models. Their scores will be tracked to assure adequate progress and highlight weaknesses. In order to understand renal physiology, students must learn anatomy at the molecular level. They will be asked to place the correct transporters on the apical and basolateral surfaces of the cell. Students are required to achieve a passing score,
at which point they will begin to build upon their knowledge of molecular anatomy with physiology.
Urine flow is added to stimulate ion reabsorption in the proximal convoluted tubule. Due to the dynamic nature of Nephro360, students can monitor reabsorption and secretion rates of any molecule all in real time. Students are prompted to complete the reabsorption circuit by adding the missing transporter. Once added and the circuit complete, physiologic processes will continue appropriately.
Students will also be prompted to change the reabsorption and secretion rates through the administration of drugs or hormones, which will be represented on dynamic graphs for easy tracking and visualization.
Nephro360 features clinical scenarios. Students can access the patient's history and perform select maneuvers of a physical exam, including auscultation.
Based on the history and physical exam, they can order the appropriate lab values, imaging tests, and biopsies.
The values and images are displayed on a monitor for the student to review. Based on the scenario, ordering appropriate tests will award points, whereas inappropriate tests will deduct points.
Lastly, voice recognition software allows the student to say their differential diagnosis and check it against a professional's differential.
Nephro360 gives students the ability to learn the renal system inside of a fun, interactive environment. We hope that this is going to increase interest and also knowledge inside of the field of nephrology.
Thank you very much to the ASN Selection Committee for your consideration of our proposal.